Thank you. Could I found an old council procedures that I used to have. Good stuff. Good evening, everybody. Happy New Year. Happy New Year. Is it too early to say Merry Christmas? Welcome to January 2024 meeting of the full council. We've got several important items of business on the agenda this evening that we will deal with following several announcements. Item 1 is apologies. Do we have any apologies? No? We're all in attendance. Good. Item 2, any declarations of interest? No. Item 3 is minutes of the meetings of council held on the 22nd of November 2023 and 7th of December 2023. We will now approve the minutes of these three meetings in... why have I only given 2 dates, but there's 3 meetings? Held... Sorry?
2 meetings on 1 day.
Oh, okay. In November and December. Will somebody please move these? Do I have a mover? Thank you, Councillor Shanker. Can I have a seconder?
Mr Mayor, is there opportunity to comment on the minutes at all?
Sorry?
Is there opportunity to comment on the minutes?
On accuracy only.
Yes, but first of all, can I have a seconder? Thank you.
He can only comment on accuracy, Mr Mayor.
Take any speakers so you can comment on the accuracy.
Yes, thank you, Mr Mayor. It's regarding the item 3B, the minutes of the ordinary meeting from the 22nd of November. Colleagues will like to remember that at that meeting I asked Councillor Dinser a question on neighbourhood board funding. And in my question, it's noted as the 4th question down, I believe, in the members' questions. And I asked Councillor Dinser to guarantee that by March 2024, neighbourhood boards would...
Is this a matter of accuracy, Mr Mayor?
Yes? Yeah.
We've got to understand what his question is before we can ask if it's inaccurate.
So I asked, as part of the changes brought about by 4-year elections, the localities model, we'd be able to roll neighbourhood board funding over from the previous year. As I've been told by various officers, we were not able to do so. In Councillor Dinser's response, he stated, and I quote, it's been confirmed that funding can be rolled over, and said of my understanding of the situation, that is not the case, and that is not true. Within a few days...
Is that actually stated in the minutes?
It's the question is referenced, Mr Mayor, but the wording is not.
So it's
okay.
not in the minute?
It's still a question. I'd
say that in the minutes,
it's not much longer, Mr Mayor. I'd appreciate the opportunity to continue.
Not in the minutes, so therefore it is not an issue of accuracy. It would be, I mean, Councillor Dinser has not indicated that he wishes to say anything, so I would suggest that we move on at this point.
Okay. Okay, it's not in the minutes, so I'm not going to take this, unless, of course, Councillor Dinser wishes to respond to it. No. So can I take that as a true record? All in favour? Thank you. Item 4, announcements from the Mayor. I have a small number of announcements to make this evening. Before I do, I'd like to deal with some housekeeping matters. Please note that the following publication of the agenda, I have accepted an urgent item of business. This is a referral of a minute extract from the Council Cabinet last Wednesday to a full council relating to the calculation of the council tax base. This allows for the level of council tax to be set at our February meeting. The item was included on your agenda front sheet and the minute extract circulated late last week. As always, I remind you to turn your microphones on when addressing the meeting. Please switch your phones off and face the front of the room, otherwise you may not be heard properly either in the chamber or on live stream. Mayoral events. Both the Deputy Mayor and I enjoyed attending a wide range of engagements through the festive season, where we had the opportunity to celebrate Christmas and look forward to 2024 with people across Derby. It was fantastic to join the Derby City Council staff choir at the civic reception shortly before Christmas, and also attend the press night for Mother Goose at the Derby Arena. I would like to wish everyone well for the new year. It will certainly be a busy one here at Derby City Council. I look forward to doing as much as possible for the remainder in my term of office. Finally, I'm saddened to report the passing of Mick Walker, who was a Labour councillor for Abbey Ward between 1972 and 1999. Former Councillor Walker served as leader of the council between 1979 and 1983. He was the chair of Planning Committee from 1983 to 1988, He was also a trade union leader at Rolls-Royce and the longest-serving board member of Sinfonia Viva. I knew Mick when I was first elected in the council in 1995, and I recall he was someone who hated personal fuss and was particularly modest, even to the extent that when the Queen came to grant Derby City status in 1977, he sent his deputy to attend the civic reception in his place. Despite being the most senior member of his group for many years, he declined the mayoralty on several occasions. I'd like to offer my own tribute in that he was a very fine man. I got on very well with him. My very first ward that I got elected to was a ward called Kingsway, which doesn't exist anymore, and he actually lived in that ward, and it was a privilege to have met him. It was a privilege to have known him, and he was a very good councillor for the city. So before we pause for a minute's silence, I'd like to offer any councillors who knew Mick Walker to offer their reflections. Councillor Dinser.
Thank you, Mr. Mayor. Yes, I mean, I want to, Mick Walker was a stalwart of the Labour Party and, as you already indicated, a great citizen and servant for the city of Derby. 85 years old, he was an established member of this council for 27 years, from 1972 to 1999. I had the pleasure of being on the council with him, as you did, for a number of, about 3 or 4 years. I didn't know him when he was the leader of the council for a number of years, but his approach to leading this council and his approach to being a city councillor and an individual of great personality he was measured, and he had a dry sense of humour, and just like his taste in red wine, and he really was serious in terms of getting the business done of this council, but I think he needs to be remembered also for his love of arts. He was on the Derby Playhouse for many, many years, and you mentioned Viva Sinfonia. I believe he was instrumental in setting up Viva Sinfonia in those early days, and his commitment never wavered in terms of his contribution. He will be well remembered in terms of his friendship with Melvyn Bragg and Philip Whitehead, who was another great servant of the city of Derby, as an MP and an MEP, and they were close friends, and they did a lot of walking in our beautiful Derbyshire countryside together. I think I will remember him with really fond memories. He was a colleague for a longer time with my father, who was on the council. They were the old traditional politicians who did the city proud. And I'm really sad to hear of his passing, but I think we should all fondly remember him for his contribution, not only as a city councillor, but to the civic and artistic life of the city. Thank you.
Thank you. Councillor Hazelgrave.
I knew of Mick Walker when I arrived for my first job in the city in 1977 onwards, but didn't get to know him personally until he contacted me as a member of Abbey Ward, and I'm a successor to him as a councillor of Abbey Ward, and he was very helpful. He lived on St Clair's Close with his wife Helen, and reported any issues, particularly concerning the communal bins for each of the blocks, which went through some issues at times because people would contaminate through not being aware of which bin to use, etc. He was very helpful, he'd be kind of the eyes and ears in that area, and reported back so that I could help all residents by getting fixes for it fairly quickly. It was always a really good chap to talk to, and we had a chat sometimes when I called round, and he'll really be sadly missed by his contemporaries who are still around, I know that Helen will find it a difficult thing to kind of cope after so many years married. I think they were 55 years married, she said, but I might be out by a year or two. I do think it's very worthy that we have the minute's silence in respect of Mick.
Thank you. Councillor Kerr.
I overlapped for a while with Mick when I was first a councillor, and it was his knowledge of planning that I think was strongest to me, and his belief in the city and wanting to guide the direction of the way the city evolved, and his respect for the city and its history and its future. And I loved the way that he was non-partisan. He would always put the city first. He obviously had his political views, but they coloured what he said without dictating what he said. And he was well respected. He was a good man for this city.
Okay, if I can ask you to stand. A minute's silence. Thank you very much. If you can all sit. Okay, item 5, statements by members of the Council Cabinet. I understand there are none. Item 6 is questions from the members of public. We have 5. We will now hear questions from the members of the public to the Cabinet members. We've received 5 in total. As we've done before in recent meetings, we will move directly to the supplementary questions unless a response has not already been provided in the booklet. Public questions are limited to 30 minutes in duration. Please be prompt when answering your questions.
Vanessa's not here.
Okay, the First Lady, Vanessa Boone, is not here. We have Geoffrey Marshall. Do you have a supplementary, please?
My thanks to Councillor Hazelgrave. May I thank you all, join you all, hopefully, in thanking the 105 households who have welcomed the 224 refugees from Ukraine into our city. Like you, probably, I walked through a group of freezing, silent protesters to get in here this evening. So forgive me for editing on my phone my supplementary question one bit. It's still about refugees. The continuing genocide in Gaza could lead to a refugee crisis very much greater than the Ukrainian one we've dealt with in the city. So my question is this, how can members of this council in our city of sanctuary work to bring about a permanent ceasefire in the Middle East?
I'm not quite sure that that relates to the question of the settlement of the Ukrainian refugees. I mean, that's a slightly different question. And so there's absolutely no need to answer that question unless you wish to, Councillor Hazelgrave.
Only to say that clearly the conflict in Gaza troubles us all greatly. And some may say we can't do a lot in Derby about it directly, but the day may come when there is a diaspora from Gaza, and it would be understandable if that were the case. And if we were to get Palestinians who were to seek refuge in this country, then Derby would be a city of sanctuary. We would clearly welcome anyone who wants to make their new home into our city. We have the New Arrivals Alliance, which is just going to be launched next week. And the New Arrivals Alliance is basically a kind of coming together of all sorts of voluntary organisations which help people who are new to the city from abroad. in helping them to settle down, to get accommodation, to get all the things their children need if they have children in the family, and also to help them to seek eventually to become productive members of their community by finding appropriate work. So that, in that context, anyone from Palestine who came would be treated in exactly the same way. And I would hope that, you know, should there be a diaspora, that we will play our part in providing that service. Other questions are bigger than my portfolio, and I don't think it would be particularly apt for me to reply to those aspects. I hope you understand.
Thank you. Simon Bacon, do you have a supplementary to drain and gully clearance?
Ceasefire. This council needs to pass an emergency motion calling for a ceasefire tonight. Portsmouth, Preston and Lancashire councils have all passed motions calling for
It's on the back of your sheet how to deal with this if you want to. You can ask them to stop. Ask them to stop now.
Can I ask you to be quiet, please? This is a full council meeting. Can I please ask you to be quiet? Okay, you're here to observe the meeting. You're quite welcome to observe the meeting. If you wish to display flags, that's entirely up to you, but we will carry on with the business. Simon Bacon, do you have a supplementary to drain and gully clearance?
I do, Mr. Mayor, thank you. I'm, just making the best of having two public questions at this meeting before you try and take that away. Just before I ask my question, I'm a little bit confused because when I was thinking about drains and gullies, I was thinking Councillor Dinser, but it seems to be Councillor Swan. Is that, am I addressing Councillor Swan? No, I said before, pay attention.
It
is actually me, Simon.
That's
okay,
fine, I just want to clarify. Thank you.
Let him ask his question. Is Councillor Swan?
I just thought it was drain related, so I thought it would be highways. Thank you, Councillor Bolton. Thank you. Thank you, Councillor Swan, for your response. Derby and the whole of the country have been struck by high levels of flooding due to extended periods of rain, and block gullies form part of that issue and can also encourage the development of potholes. Are you confident, Councillor Swan, that one gully truck for over 43,000 drains in the city is enough to protect the city highway network? Thank you.
Councillor Swan.
Thank you, Simon. You do actually raise a very, very good question, and the answer is probably not. But due to budget cuts, we cannot invest in such infrastructure such as a new gully truck. But it is something we would definitely consider in future budgets. Thank you.
Okay, Vanessa Boone still isn't here. So the next question is Simon Bacon. Do you have a supplementary to your Sinfin waste treatment plant question?
I do, I nearly called you Councillor Gravesend. Mr. Mayor, thank you very much. God, they're coming thick and fast today, aren't they? It's a bit like the drains. In my question, Councillor Shanker, I asked for your view on Councillor Spencer's comments, Councillor Spencer being the Deputy Leader of Derbyshire County Council, in relation to the Sinfin incinerator project. Do you think that the County Councillor Deputy Leader was right to ignore the issues I raised and tell me to ask you instead? Thank you.
No.
Okay, thank you very much. Item 7 is questions relating to the Fire Authority or Derby Homes. We have received none. So then item 8 is questions from non-council cabinet members. We have 2. First one is Councillor Evans. Do you have any supplementary?
Yes, Mr. Mayor. Thank you. Thank you, Councillor Dinser, for your response. It's disappointing to know that you're supporting the council's stance to turn down the offer of this swing, and I believe it might be nearer 16,000 for the swing alone that the resident of Ulverston was willing to pay. Would you agree, though, that in this day and age, with communication that we have, mobile phones and so on, that it wouldn't be beyond the realms of possibility to arrange time slots where, if that swing was in Ulverston, somebody could make a phone call at certain times on a Friday afternoon or whatever, where there'd be people available within 15, 20 minutes or so who could facilitate the swing in Ulverston. Thank you.
Councillor Dinser.
Thank you, Councillor Evans, for your supplementary. I mean, I really tried hard because I met with the gentleman who offered the £10,000 for the specialist swing facility and his aspirations, and I totally agreed and sort of championed those. But I think in terms of our resourcing and as many people who've been involved with it, the technical approach to actually using the swing and the resource needed, it would be difficult for me to say that operationally we can have somebody coming over just for that, albeit it may be very rare. You know, it's not going to be everybody in the public, it's going to be specialist people. So I'm still committed to providing as much as possible to make access for disabled people available. The 10,000 was, I think, so if it's more, I understand that. 6,000 was going to be for the installation with the council would have picked up. But the crucial bit was about having somebody who is trained and able to support the use of the swing. And that's really difficult. And on that basis, on the balance of probabilities, despite pushing it to be where the gentleman wanted it, in Alverson Park, it's unfortunately not been possible. But we won't give up. We want to continue to look at options and resources in the future. I still think the option of going to Markeaton Park, where there is staff available, and where we have a specialist toilet as well as in Alveston, is still worth considering. Because it will not only benefit the gentleman and his daughter, I think, who sort of would be able to use it, but many other people, not necessarily from Derby City, because I think, as he acknowledged, it can be much further afield, and it can still be a great facility to have. So I still would suggest to him to sort of consider that, and I'm happy to meet with him to actually discuss that further.
Thank you. Next question is from Councillor Cuss about compactor days. Have you got a supplementary? Thank you very much. That ends those questions. We now move on to item 9, the minute extract 103.23 of the Council Cabinet meeting held on the 6th of December. We will now consider a minute extract from the Council Cabinet relating to the Treasury Management Mid-Year Report for 2023-24. It is recommended by the Chartered Institute for Public Finance and Accountancy that Treasury Management mid-year and outturn reports are considered by the full Council. Councillor Shanker, as the Cabinet Member for the Responsibility for Finance, will you move the minute, please?
Yes, Mr. Mayor, I move the minute as printed.
You don't wish to speak on it? Good. Are there any speakers on this? No, thank you. Can I ask to move to the vote? All those in favour?
Do we have a seconder?
Oh, sorry, I needed a second. I beg your pardon, Councillor Peatfield. All those in favour? Anybody against? Item 10, minute extract 121.23 of the Council Cabinet meeting held on the 10th of January 2024. We will now move to the urgent item I referred to earlier. This is a minute extract from the Council Cabinet last Wednesday seeking approval for the calculation of the council tax base. Councillor Shanker, would you move this minute, please?
Yes, Mr. Mayor, I'd move the minute as printed also.
Do I have a seconder? Thank you. Are there any speakers? All those in favour? Anybody against? Thank you. Item 11, constitutional review. The next item of business is the outcome of the constitutional review. Councillors will recall that Council has been reviewing its constitutional arrangements since July 2022. The report presents the conclusion of this work based on the recommendations of the Centre for Governance and Scrutiny and a cross-party working group of councillors. Should the recommendations be approved, the new constitution would come into effect from May 2024. Please note, once moved and seconded, the recommendations can be debated and amended as per the normal rules of debate. A simple majority is required to approve the new constitution. There is no actual person to lead this, but Councillor Shanker, as the leader of the council, will you move the recommendations, please?
Thank you, Mr. Mayor. Yes, I will. This report is a product of 18 months' worth of work undertaken at the request of this council, and I think it's just worth noting it's not my report, as you've said, it's not the previous leader's report, the administration's report, or the previous administration's report. it was agreed to undertake a constitutional review supported, as you've said, by a nationally recognised centre of expertise on matters of governance and scrutiny back in July 22. And as part of that process, every group on this council initially took part in workshops to gather their feedback, and the company involved then drafted a constitution which was extensively consulted upon via the working group that was set up, the cross-party working group that was set up, and I'd hope members on that group consulted their various groups. And I'd like to pass on my personal thanks to each and every one of those members on that group, including yourself, Mr. Mayor, and your deputy when you couldn't make it, Councillor Kerr, Councillor Ingle, I think, was involved from the Independent group, Councillor Wright and Potter from the Conservative group, and colleagues, Councillor Bolton and Hazelgrave from the Labour group. It's time-consuming, but a very thorough process, as one would expect for such an important document. And in those circumstances, I would have hoped we could have reached an agreement this evening by approving the recommendations or considering any amendments that members felt were needed, despite, again, more consultation and support from officers who did a briefing prior to Christmas for all members who were invited to attend that. And we should put on record, I'm sure everyone agrees, our thanks to Alex, because it took a considerable amount of work. We had unfortunately a constitution, we still have a constitution, which has probably been light touched several times, but never been through a process and undergone such extensive work as we've seen now. But I have had a number of conversations with some representatives from other groups today. Other representatives did promise to get back to me, but unfortunately didn't. But I do believe we don't have consensus at this stage for this document, which is rather unfortunate and a bit of a bad reflection, I think, on the workings of the council and the politics of this chamber. So therefore, with your permission, Mr. Mayor, under Council Procedure Rule CP 42G, I request that this item is withdrawn from consideration pending further consultation with the councillors on that working group, and then it's reconsidered at our next meeting in February, which is only a number of weeks away. But I would hope the working group can get together a bit of a shorter session, possibly, or whatever duration is needed, do the final snagging on this draft constitution, and then we bring it back to full council and hopefully get agreement from all members.
Well, I'm going to take a vote on it. Do we want to withdraw? Sorry, Councillor Kerr, would you like to?
I don't know whether that requires a seconder, but I would be happy to second that. I thought the working party was very good at finding a consensus way forward. We were from different groups, but there was general agreement in the things that we thought were important and things that needed to be looked at again. Where the document that we now have has, I think, addressed some of those points, but not necessarily in the way that the group would be happy with, and some of them not sufficiently. And I think there's also some concerns, particularly about the scrutiny process, where I think it would be useful to have a bit more clarity before leaving that in a to-be-done box, because at the moment it seems to be in a bit of a to-be-done box. And I think we need to have confidence that the scrutiny processes within the council are going to work well. And I think the other area that particularly my group feels is not yet right is ensuring that full council will be able to be responsive to what members feel is needed during a meeting, whether or not the mayor thinks it is important. And with respect, Mr Mayor, no reflection on you, but for the future of the council.
Thank you, Councillor Kerr. Actually, what I'm going to do here tonight is what Councillor Shankar is actually saying is that he doesn't want to recommend these recommendations. Is there anybody in the council that does want to recommend the constitutional review? Because it isn't Councillor Shankar's ball, it's actually all of ours responsibilities. Anybody else wish to put forward the recommendations? No? So on that basis then, you're happy for me to... So Councillor Hassel.
I don't want to propose it, sorry, Mr Mayor. But I think it's just worthy of saying that this group does echo Councillor Shankar's comments for the work that has gone into this document, particularly Alex, who I know has put a lot of work into it, and our gratitude for him on that. However, I think that the constitutional draft document that we had presented to us this evening falls short on a number of areas that we as councillors, I don't think, could agree, and certainly this group couldn't. And we have discussed it and debated it at length. And there's a number of specific areas which I think is relevant to bring out at this point, so it can be fed into any sort of retrospective discussion. Particularly our concerns are around public questioning and sort of the regressive nature that that appears to have with regards to having one question per member.
Can you please be quiet? Please. Sorry, Councillor Hassel, continue.
Thank you, Mr Mayor. So, yeah, just back to public questions, allowing just one question per person.
Councillor Hassel, can I just stop you there, because we haven't actually had a seconder for this. We haven't even had a proposer yet. What we've had is a recommendation to withdraw it. If anybody wishes to propose this paper, then I'm willing to carry on with the debate, but we can't debate it unless we get a proposer and a seconder.
Okay, I'll propose it then, Mr Mayor.
Okay, do we have a seconder? Councillor Roustan, thank you.
Thank you.
Continue.
Thank you.
Sorry, can we have quiet, please? Councillor Hassel.
Thank you. So, yeah, concerns around public questioning, no supplemental questions, no placards.
We don't need to vote on.
And equally extended to members' questions with only one question per member.
Can I just, sorry, Councillor Hassel, can I just make some clarity? What I've asked for is, we've asked Councillor Shanker to propose this, and he doesn't want to propose it, he wants to withdraw it. So what I've suggested to the council chamber, if we want to continue debating this, then we need a proposer and a seconder. I've now got a proposer and a seconder, so we're not withdrawing the motion, we're continuing, so we can debate it. Yeah, and I've rejected it. I've rejected it. Well, I thought I said by getting a proposer and a seconder, then what that does is it negates the withdrawing motion. Okay, I'm formally saying that we're not accepting...
Mr Mayor, can I speak?
I'm going to adjourn the meeting for 2 minutes. If you just go and get yourself a drink, go to the toilet while we have a discussion. Thank you. Thank you. Please be seated. Right, we'll carry on from where we left off. Councillor Hassel, would you like to continue?
No.
Thank you, Mr. Mayor. Following seeking guidance, I would like to withdraw my proposal to propose this. Do you want me to wait for you all night? I can do. This is quite an important document. You can laugh about it if you like, Councillor Whitby.
Councillor Hassel, come on, just ignore them and just say what you've got to say.
Okay, so I'd like to withdraw my previous proposal and I would like to agree with Councillor Shanker's removal of this motion, subject to when the working group can reconvene and feel it's appropriate to bring it back to this chamber. Thank you.
Thank you. Is there anybody else that wishes to present this motion? No? Okay, then I will accept the withdrawal of the motion that Councillor Shanker put forward. Item 12, polling place review. The final report this evening is in relation to a recent review of polling districts, polling places and polling stations that is statutorily required to take place between the 1st of October 2023 and the 31st of January 2025. The report presents a series of recommendations following a recent public consultation. Councillor Shanker, I understand this falls under your portfolio. Will you move the recommendations, please?
Thank you, Mr. Mayor. The Council conducted the review in compliance with the Representation of the People Act 1983 and also the Electoral Registration and Administration Act 2013, fulfilling its legal obligation to periodically review polling districts and places. The review proposes changes in the scheme of polling districts and places as detailed in the attached appendices, aimed at improving electoral facilities and accessibility. Public consultation included a survey with responses considered in formulating the final proposals. Feedback from councillors and other stakeholders played a significant role in the review process. The number of polling districts has been reduced from 102 to 95, improving the alignment with the current ward boundaries and eliminating small, less efficient polling districts. I move the recommendations in the report, Mr. Mayor.
Thank you. Do I have a seconder? Thank you. Are there any speakers? Councillor Kerr.
Mr. Mayor, colleagues, this is clearly a technical paper and it's one very important to us, and it will be important this coming year because we know there are going to be elections in May. Just to, in case there is anything here that might be untoward and might need a small technical tweak, I would suggest that we have a second recommendation delegating to the monitoring officer, returning officer, whatever role she has at this point, just in case there is anything here that needs to be tweaked for the efficient operation of our elections. I hope that somebody will be able to second me in doing that.
Debate. Accept that without debate.
The monitoring officer said she hasn't got enough work and she's happy to accept that.
File it on. Are you happy to accept that?
Yeah, I'm happy to.
Are you happy to accept that? Yeah. Okay. Councillor Lonsdale.
It's just that I'd second it.
No, we've already got a seconder. Any other speakers? All those in favour? Anybody against? Thank you very much. That's carried. Right, item 13, we move on to notices of motion. We will now consider a notice of motion, item 13, which is the NHS dentistry isn't working, implemented fundamental reform. It's moved by Councillor Martin and seconded by Councillor Dinser. Councillor Martin, would you like to present this?
Yes, I believe they just want to change the seconder.
So you want?
Thank you. Yes, I'll be the seconder. Councillor Kozlowski.
Sorry, what's her name?
Councillor Kozlowski.
Kozlowski. Okay.
Thank you. Thanks. Okay. So this motion draws attention to a problem which I think most people in this chamber will be very familiar with, which is problems accessing an NHS dentist and the related costs of dentistry. But for all that it is a familiar problem, the problems with dentistry are often not addressed, really, or very often, increasingly now, they're viewed as inevitable or just how it is now. But we can't afford to be complacent about dentistry. It's not a minor issue. Failing oral health is not just about inconvenience and pain. It can affect people's life chances and their job prospects. Poor teeth can lead to negative perceptions of oneself and a lack of social confidence, poor nutrition, and if cavities aren't treated, they can cause other health conditions. Shall I give way to Councillor Lonsdale? Is there a problem? Okay, right, thanks. Okay. Looking after your teeth matters, and dentists play a very important role in that. I mean, I know you all know that, but it is worth stating it publicly. Here in Derby, we know that many dentists have stopped seeing NHS patients, and people right across the social spectrum, actually, report that they cannot access an NHS dentist, even for their children. But we also know that a significant proportion of Derby's population is among the most deprived in the country, according to the Index of Multiple Deprivation. These are the people who are most likely to need a dentist and the least likely to be able to access one. In 2023, over 50% of people in Derby were not seen by a dentist, and almost 40% of children did not see a dentist. A 2022 report told us that a fifth of 5-year-olds in the city had tooth decay or missing teeth, and that wasn't just one tooth, it was several. And there are high levels of acute dental problems which need urgent treatment. Now, whilst the number of people being seen by a dentist and the number of dental appointments has started to pick up post-pandemic, the underlying trend that we have is one of declining oral health, fewer opportunities to address that, especially for the most deprived. Now, the scale of this problem is widely acknowledged, both locally and nationally, and not least by the Health and Social Care Parliamentary Select Committee, and indeed by the British Dental Association, who have said publicly and quite clearly that NHS dentistry just isn't working. For too long, problems have been seen, but they haven't been dealt with. A two-tier system has been allowed to develop. The discredited dental contract is fueling an exodus of dentists from the NHS, as they find that it doesn't reimburse the cost of their NHS work, and it doesn't focus on prevention. And also, the profession isn't structured to enable progression as an NHS dentist, leaving many newly qualified dentists with a single and not unattractive, let's face it, option of high earnings in private dentistry. This situation has been ignored for too long, and the rot has set in. 2022 government attempts to reform the contract are not enough to attract dentists back to the NHS. As the Select Committee says, fundamental reform is urgently needed, along with increased funding to deliver that reform. So, for the sake of people's oral health in Derby, we need to call upon the government to make dentistry a priority and to act sooner rather than later. Thank you.
Thank you. Councillor Kozłowski, you've got a right to speak, or you can reserve your right to speak. You wish to speak? Thank you.
Thank you. I'm a new councillor in Chaddiston West, and amongst the concerns I expected to hear from residents in this new role, I wasn't expecting to hear quite so much from residents about dentistry. The lack of dentists in Derby, even though some people are prepared to travel some distances, is affecting people on the doorstep, they're reporting it at surgeries. Some people have spent months or years on waiting lists. One resident has described that her NHS dentist in Derby changed to be fully private and that there were no NHS alternatives available. I've looked at the opportunities myself to register for an NHS dentist, and occasionally practices will say there are vacancies for children or disabled people in receipt of certain benefits, but that's all. The resident I saw in surgery would not be taken on, and what she said she would do in future is, as she couldn't afford a private dentist for routine care, she would only go if she had a problem. I've spoken to another resident who was very distressed and in dental pain, and she had used the NHS 111 dental service and received advice and a referral to an emergency dentist. And she'd been doing this, continues to do this over 18 months with no prospect at all of being registered at any dental practice. So she manages a crisis and then is back to square one when it happens again. These kinds of experiences are being expressed repeatedly amongst the community. And apart from having functional teeth or having teeth that look nice, a dentist also checks oral health, including mouth cancers. And even the best advice to citizens, it doesn't replace the checks by medically qualified dentists. We continue to lose dentists to the private sector, and we need to attract dentists back to the NHS. The figures that Councillor Martin describes, that in 2023 over 50% of Derby people were not seen by a dentist, is likely to worsen if we do not have fundamental reform and the government makes dentistry a priority now. Thank you.
Thank you, Councillor. Councillor Lonsdale.
Thank you, Mr Mayor. I'd like to propose an amendment, if I may. I've never done this before, so what do I do? Take it up. So just take it up.
Somebody will come to collect it from you.
I mean, it's fairly simple.
Are councillors okay if I read this out rather than print it out? Because obviously this is a late amendment and it will just take a few minutes to do some printing. It's quite a simple amendment. It's a third point on the motion. The full council resolves to ensure public health work with local dentists, charities, schools and other stakeholders to provide a public education campaign to help improve dental health city-wide. Would you like that to be printed out? No?
So can you just clarify, is that adding a third point?
Yes.
Okay, and would you mind reading that again, please?
Yep, sure. So as a third point, ensure public health work with local dentists, charities, schools and other stakeholders to provide a public education campaign to help improve dental health city-wide. So my question to you is, do you want that printing out, or are you happy to take that verbally?
Mr Mayor, just for a point of accuracy, happy to leave it as it is, as read out verbally, but rather than ensure, because we can't do that, can we encourage? Can we change the word ensure to encourage?
I'll read it out for a third time. Point 3, encourage public health work with local dentists, charities, schools and other stakeholders to provide a public education campaign to help improve dental health citywide. Councillor Lonsdale, do you want to speak on this?
I can do, yes.
Carry on.
All right. I think Councillor Martin's motion is really good and very much approve of it. I just felt that it was very much going up the way, but not much coming down into our local area. So I thought we should be doing something locally as well, which is why I have created this amendment. Yeah, otherwise, I'm really happy with the motion as it stands anyway, but I just thought we could do a little bit more and add a little bit more depth to the motion that Councillor Martin put forward.
Can I have a seconder for that, please? Councillor Kerr, thank you. Would you like to speak?
Can I reserve my right to speak?
You can indeed. Just to remind members that we are speaking on the amendment now, on the amended motion. So if you want to speak on it, Councillor Martin.
Thank you very much. Yes, thank you, Councillor Lonsdale. I'm very happy to accept this amendment. I very much appreciate the point you're making. Some of you are members of the Health and Wellbeing Board, and you'll be aware that we are, in fact, as it happens coincidentally, receiving a report from the ICB tomorrow on what is happening locally on dentistry. And of course, as always, Public Health and the Council and other partners always do the best, what they can, their utmost, to alleviate problems in the system. Just to explain that I very much focus this on government action, because I know that's what all the professional bodies and other health bodies are also concerned about, to really get cut through to give that fundamental reform. But never, so that's why there was that government focus in my in the original motion. However, I don't think adding point 3 detracts from that, and it just recognises the work that will be taking place locally. So I'd be happy to accept this amendment. Thank you.
Thank you. Councillor Repton. Yeah, it's fine.
No, the amendment.
It's the amendment.
You speak on the amendment.
It's spent on the amendment. We haven't voted on the amended.
Any more speakers on the amendment?
Are there any more speakers on the amendment? Because we can take a vote on the amendment, get the amendment out of the way, and then we can carry on speaking on the substantive. Everybody happy with that? All those in favour of the amendment, please show. All those against? That's carried. We've now got an amended motion. Councillor Repton, would you like to continue?
Thank you, Mr. Mayor. According to the Nuffield Trust, dentistry in this country is at its most perilous in its 75-year history. More than half of dental surgeries in England aren't accepting new patients, with 8 in 10 refusing to take on any new adults, 7 in 10 closing their doors on child patients. We have 6 million adults tried and failed to get an appointment in the last 2 years, and 1 in 10 has attempted some form of DIY dentistry in recent times. Oral cancer is one of the fastest and rising types of cancer and kills more people than car accidents in the UK. And that is why the motion before us tonight is important to get passed. And what we do need, following on from that, nationally, I believe, we need hundreds of thousands of more urgent appointments. We need new incentives for new dentists to work in areas of the greatest need. We need supervised toothbrushing of children's teeth between 3 and 5 at school to get them into the habit of good oral hygiene. And we need, most importantly of all, a reform of the dental contract to rebuild the services that's been left to decay in recent years. Thank you, Mr. Mayor.
Thank you. Councillor Whitby.
Thank you, Mr. Mayor. Yeah, just my personal experience as a foster carer. We had a child in care whose school rang us up to say, we're sending him home, he's in terrible pain, he needs an emergency dental appointment, which I'd never booked before, so I wasn't sure what to expect, but yeah, I rang and was very surprised when I was told that the emergency appointment would be the next day. That was the first shock. So when I eventually got to the appointment, the dentist was extremely supportive and wanted to go over and above what he was required to do, but told me very clearly that despite the child being in care and therefore I'm sure top of any admissions policy going, he still couldn't take him on his books. And I suppose that's just the reality of the situation we're in. And the consequence of that is that we've got this incredible situation where there's the number one reason for children between the ages of 6 and 10 being admitted to hospital is tooth decay. It is such a crazy situation, and it just proves that if you don't fund this upfront adequately, we just pay for it further down the line. It is just a false economy. So we need to support the motion. Thank you.
Thank you. Councillor Ashby.
Having worked in general practice for almost 30 years, I can testify seeing a huge change. When I was first in general practice, one hardly ever saw patients approaching general practice for help with dental problems. When I retired last summer, there were weekly and frequent appointments being wasted in general practice who have no appointments to waste, with patients coming for help with dental problems. And that's just one tiny example of why it's a false economy, because we all know the shortage of GP appointments, and it takes time to explain to patients that actually general practice can't help them with dental problems. I agree very much with what Councillor Whitby said about the false economy, because what has also got to be taken notice of, and I would hope, and it's one of the reasons for the motion, is the very big false economy of not funding dental care properly and dental, preventative dental care, because of the huge risk of other health problems. For example, bacterial endocarditis, which is life-threatening, which can be a direct result of untreated dental abscesses. It's bacteria getting in through the mouth that causes this terrible cardiac problem and other cardiac problems. Recent research shows also that there's a link between poor dental health, poor gum health, and dementia. And none of us are getting younger. We all know the incidence of dementia is getting greater in the country and in the world. If we can reduce that by proper dental care in childhood and throughout life, why aren't we doing it? The cost to the nation of dementia is going to be ever-growing, and is an ever-growing threat and concern for all of us. I echo what Councillor Whitby said also about the huge cost of the children in Derby having dental extractions and hospital admissions. I would say in response to the amendment, but it's fine that it's there, that we did actually hear at the last Health and Wellbeing Board of the work already going on in encouraging good dental hygiene in schools. But it would be good to have it not just with the children learn from the parents, so it would be good to have it as a public health campaign across the city as well. Thank you.
Thank you. Councillor Kerr.
Just two further points to briefly add, in that if you have managed to get a registration with a dentist, it doesn't mean you'll necessarily get an appointment. Just as you can be registered with a GP, it doesn't mean there's an appointment waiting for you. And just another example of the link between poor dental health, oral health, and infections. There's a significant correlation between those who were hospitalised and also those who died from COVID and the state of their mouths. So it is really, really important, and as well as all the things we've mentioned, the other thing we need is training, and more people being trained to provide those services to us as a society. I don't know if it's something that we have discussed with the university and whether it's something that they could be able to do more of.
Thank you. Councillor Hazelgrave.
Thank you, Mr. Mayor. I'd just like to home in on the under fives. Councillor Whitby referred to the problems of children aged 6 to 10, but of course they start in years 1 to 5 for many. And I think I read in The Guardian somewhere that about 20% of under fives are not registered with a dentist. Clearly, the reference also to supervised tooth cleaning in schools is important, because there seems to be, because parents aren't with a dentist and only rely on a dentist at an emergency, there's no thought about the constant necessity, and particularly even at early years, to improve and maintain dental health. And I know for a fact that some parents bring their really young children to school, and the state of their teeth is a bit, you know, far from ideal. And their comment to anyone who says something about it is they're only milk teeth. Well, of course, hygiene for milk teeth and dental hygiene starts at those early years. You can't just discard the first years in the first set of teeth and decide when the main teeth come along that it's time to start that, because it's too late. It has to be instilled from a really early age so it becomes routine, not even thought about, it just happens. So I'm really pleased that we brought this motion. I did think it was important to look at making sure that even the youngest are looked at it with serious, because they're the ones who are going to have the ongoing problem for years. The family hubs will be a help, and the education will also be a help. So I do think this is a really important motion, and as many people have said, it basically relies on making the dental service for the national health more attractive, and also that we have dentists online and are starting to look at plans to actually get dentists online fairly quickly to address the shortfall that we have at the moment.
Thank you. Councillor Martin, you have a right to reply.
Okay. Thank you for everyone who's spoken on this motion, and so personally and so passionately. The only personal point I would add to this is to say that I have given birth twice, and I can honestly say that dental pain is the worst pain I've ever experienced. So I think the government, Sunak in particular, has promised action on dentistry, and I think it hasn't happened. It's not happening. It's not deep enough. It's not fast enough. It's not convincing enough. And I think what we're seeing here is that the government's neglect of dentistry to this extent is yet another betrayal of the 1945 social contract. And where dentistry is now, the rest of the NHS is very much in its track and is going. So we have a two-tier system with high expense for those who can pay and a token service for those who can't. So I think the government must act now to enable dentists to do the work that many of them actually do want to do, and the work that they know is right. So in order to get that message to government from Derby, I'm asking you to support the motion. Thank you.
Okay, thank you. Can you show all those in favour by show of hands? Smile while you do it. See your teeth. Anybody against? Thank you, that's carried. That concludes our business this evening. Thank you to everyone in the Council Chamber, and for those watching online. We will see you all again when we meet in February for the annual budget meeting. Woohoo!